We are checking in for another appointment here at Team Rehab Physical Therapy, talking to our physical therapy expert, Josh Butcher. Today, we're chatting about hip bursitis. What is this condition and what causes it?
Yeah, we see a lot of hip bursitis. Well, really, I don't call it that anymore. A lot of people don't call it. We usually call it greater trochanteric pain syndrome because hip bursitis is kind of this like catch-all term for lateral or outer hip pain, but it's rarely actually the bursa that's involved. So it can be tendons that attach to that side of the hip bone. It can be the bursa. It could be the IT band as it crosses over there. It's something that's inflamed or weakened, tender, irritated at the outer hip.
And how do you evaluate that here?
So like a lot of things we got to determine, is it truly coming from the hip? Because sometimes it can be a back condition that radiates there and we're treating the wrong thing. So you do a thorough hip eval, you do a thorough lumbar spine eval, you put the pieces together and figure out what's causing that hip pain, and a lot of times it's load capacity. The hip joint is not tolerating load there like it should be. And once you figure out if that's a problem and what kind of things they're doing that are past what their capacity is and why it keeps getting inflamed, that could be a mechanical issue, that could be most of the time a weakness. So a lot of times what we see is we strengthen those outer hip muscles, we strengthen the glute complex, and things start to fade away.
What are some of the common mistakes you see people making when they're dealing with issues like this?
So I think when people say tendonitis or bursitis, some of these inflammatory conditions, that they just should rest. When really, when we're not moving the joint and we're resting, that inflammation has nowhere to go and things can kind of compound and get worse. So movement really helps with getting rid of that inflammation. Just has to be the right dosage of movement. It doesn't do the opposite and irritate it. But I think people too commonly think, I should just rest it, I just shouldn't do anything, I should just take anti-inflammatories, get an injection, and they're missing, how do I fix the problem for good?
And how do you draw up the treatment plans to make sure you're setting that balance where you're keeping people active, making sure they're strong where they need to be, but also not overworking?
Yeah, a lot of it's just education, telling them that it's safe to move and why we need to move. Picking an initial set of exercises that make sense for that condition, and then gradually dosing it higher and higher, not starting with too much and then it just exacerbates their problem. So they just learn to trust those movements, and we tweak them each week until we get them back to ultimately what they want to be doing without pain.
And how drastic is the before and after? And how satisfying is that for you to see people
It's
recover?
Great. It's a lot. So it happens a lot with like 40 to 65-year-old women, especially. And they'll come in limping, their gait's all off. They're doing one of these as they walk. They can't lay on that side. And then now, their sleep's improved. They can lay however they want. They walk better. They're back to exercising. It's a drastic difference from start to finish.
Well, Josh, again, thank you so much for teaching us again about the different treatment options that the people have here.
Thanks.
For more information, you can check out the details up on your screen right now. And if you see Josh around town, let him know that you saw him right here on 21 Alive.